Hi, I'm Tom Bagwill, and welcome to Hello Health, a partnership with the Ochsner Health System and Humana to bring Ochsner's Hello Health weekly education and information series to you. Our topic this week, diabetes. Our guest is endocrinologist Susana Dipp. First, some background. Dr. Dipp received her medical degree from the Ponce School of Medicine in Puerto Rico. She completed her internship and residency in internal medicine in Connecticut at the Yale School of Medicine at Norwalk Hospital. And she completed a fellowship in endocrinology at Brigham and Women's Hospital in Boston. And it is our pleasure to welcome Dr. Susana Dipp to Hello Health. Good to have you with us on the program.
Nice to be here.
Thanks for being here. So do you remember what inspired you to get into medicine, and how did you end up in this specialty of endocrinology?
So I really enjoyed science as a college student, and I enjoyed helping people. And so it just seemed like the right thing, natural thing to do, to go to medical school. Once I did my internship and my residency, I had an excellent teacher and mentor. Her name was Dr. Nancy Rennert, and I still see her at annual meetings, and she really is what inspired me to become an endocrinologist.
Funny you mentioned that, because usually the second part of my question is, or who was it that inspired you to get into medicine? Obviously, she's someone who led you in this direction.
Absolutely.
And is it as fulfilling as you thought it would be? Because you really are helping people change their lives.
It is. I really enjoy what I do. I really enjoy what I do. I get to meet new people. I get to help people. I get to answer questions for them and provide them with good care, or the best care that we can. I so love to hear how people are doing once they are feeling well, once their diabetes is in good control. That really is very, very inspiring.
And satisfying,
Absolutely.
I'm sure. The primary focus of this program is diabetes, but an endocrinologist works in all sorts of areas, such as?
Sure. So I'm also a hormone doctor. So one of the things we'll talk about in diabetes is the hormones that are going awry, but I also deal with other types of hormones, so thyroid hormones, adrenal hormones, female hormones, male hormones. So all the hormones and the glands that make them are the specialty of endocrinology.
So diabetes is on the rise.
That's correct.
Why? Because we know more and more about diabetes and what causes it and how to prevent it in some cases.
Sure. So yeah, diabetes is on the rise. You can see from in the figure that in 1999 there's some figures of where it is in the U.S. and with looking back, we can see that the incidence of diabetes is increasing quite impressively.
And how much of this has to do, especially in the United States, with diet and obesity?
Well, it absolutely, they go hand in hand. So the availability of high-calorie food, sedentary life, and obesity or being overweight has increased the incidence of diabetes.
Not just a problem in the United States, right? Globally on the rise too.
Absolutely. So this is not a problem that's shared by only in the United States. It is shared by other countries worldwide.
Okay. So what is diabetes mellitus, and why did we want to focus on that this evening?
Sure. So diabetes mellitus is a disease that essentially starts because you don't have enough insulin, or your insulin is not working properly. And so this leads to high sugar levels. And the high sugar levels paired with the insulin that's not working correctly is what deals with the disease state of diabetes.
As most people know, there are more than one type of diabetes, right?
Yes. So there are many types of diabetes. So type 1 diabetes is generally diagnosed in childhood, but can be diagnosed in adults. And it essentially means a lack of insulin. So your body does not make any insulin at all. And in this type of diabetes, it requires insulin as a treatment. The second and the most common form of diabetes mellitus is type 2 diabetes. And generally, your body doesn't make enough insulin or it's not working correctly. It can be seen in younger populations, probably because of the incidence of obesity, sedentary lifestyle, too many video games. But it is also the treatments. The difference is that treatments can include pills in addition to insulin.
With childhood diabetes, or childhood, sometimes referred to as childhood diabetes,
right.
Do children outgrow that early
That's a
diabetes?
great question, Tom. So no, people do not outgrow type 1 diabetes. It is a disorder that they will have for their entire life.
How does diabetes impact a person's life? I would think in a great way.
Absolutely. So initially, diabetes can be asymptomatic, meaning without any symptoms. So oftentimes patients may feel like there's something going on or not, so they don't seek medical care. And sometimes, especially initially, it may be hard for them to make the changes that we ask for patients to do because they're not really having any symptoms. When your sugars become high enough, you can have a lot of symptoms. So dry mouth, urinating all the time, feeling fatigued, dehydrated.
Vision?
Absolutely. So blurred vision is a common one, and sometimes unexplained weight loss is also a symptom.
What are the short-term and long-term complications from diabetes?
So diabetes affects everything. So it can lead to vision problems, vision loss. It can lead to poor kidney function, which can eventually lead to dialysis. It can lead to loss of nerve or sensation over your feet and hands, which is difficult to treat and can be quite painful and debilitating. It can increase your risk for heart attacks, strokes, essentially it affects every system.
One of the things we really enjoy doing on this program is sharing patient stories with you about our topic, and this week's topic is diabetes, and here is a patient who is sharing his story with us and with you.
I was traveling with the show. We were actually in Canada at the time. And I began having these intense vocal issues, and I lost my voice completely. The next day I visited an urgent care, and he tested my blood, and he told me that he suspected that I was diabetic. I was born in New York, and I moved to New Orleans with my family, my mom, when I was 6 years old. I learned that my father was a vocalist in New York, a jazz musician. When I learned that, all of a sudden this thing was woken up in me. I wanted to be a singer. And then after grad school, I moved to New York and began auditioning. And a few months later, I got a part in The Lion King. I was on the road with The Lion King when I began feeling ill, and I was put on prednisone, a steroid which was supposed to help with my vocal situation. And I knew that something was still terribly wrong. I wasn't feeling better, I wasn't getting any better, and my mother, who's in New Orleans, suggested I visit her doctor at Ochsner.
When he got to Ochsner, they immediately put him into the hospital. I believe his sugar was so high. I could not believe that this was actually happening to him, simply because I felt that diabetes 1 was basically an early childhood disease.
There's just a lot to learn with type 1 diabetes. It is a life-changing diagnosis. With him being so early in his course of diabetes, his needs were constantly fluctuating, and so that added another level of complexity.
If Kyle did not get his diabetes under control, I would have lost Kyle as a child, as a son.
I began working with the diabetic team at Ochsner, and almost immediately, that weekend, I felt my energy coming back, and since then have moved into an insulin pump and a glucose monitor, and it's just made managing this disease so much more easier and simpler. With the cast, we visit people who are dealing with illnesses all the time, just to try and bring a little joy to their lives. Now I sort of have a better understanding of what some of the patients that we visit are dealing with. And I think that connection makes it a lot more meaningful.
That has become his whole future. Being able to train others, being able to reach out, even in the community, at Ochsner.
And I'm just grateful that my care team at Ochsner has gotten me to a place where I can function normally and still be a part of society.
We're so happy the patient shared his story with us and is sharing his diagnosis and treatment with others and helping them get through this as well. So we know that he felt some voice issues, which was his work. How do others feel like? How's it diagnosed?
So I think most people will come into their doctor they can come in for either a routine appointment and they get a blood test done and voila, it shows that they have a high sugar. Sometimes it can be because they're having symptoms, like I mentioned, and they seek medical care either at an urgent care, so that's actually quite common, something that we see. People will say, you know, I was urinating quite a bit and I went to urgent care, had my blood tested, and they told me that I had diabetes.
How do people know if they're at a higher risk of developing or at a risk of developing diabetes?
So the risk factors for diabetes are pretty simple. So family history, so having a mother, a father, sister, brother with diabetes increases your risk. Being overweight or obese increases your risk. Another one is having diabetes in pregnancy can increase your risk for developing diabetes later on in life.
Is the family relation because it's the same blood, or the same, in some cases, the same lifestyle?
That's a great question. It can probably be a little bit of both. So there is a genetic component to type 2 diabetes, but there is absolutely an environmental component to type 2 diabetes.
What are some of the lifestyle changes diabetes patients will have to make or be asked to make?
So the lifestyle changes are the foundation of diabetes treatment. And I spend quite a bit of time speaking about this to my patients because it is really, they're going to get the most bang for their buck making lifestyle changes. And the biggest one is weight loss. And that means making changes to their diet. And that's the hardest, the most important, and it's difficult, but that is absolutely the most important.
And it's not just diet though, right? It's exercise, if it is weight, or is it primarily diet?
It's primarily diet. It's primarily diet. I mean, you know, exercise is important, and it's because it's very difficult to make these dietary changes. I mean, sometimes people have to just rethink the way they're eating their food. But exercise can help. It's a mental release. It makes you feel good to go out and exercise, and that carries over. That good feeling that you get when you exercise can carry over into making good decisions about your diet. But the majority of the work is really in changing your diet.
But doctor, don't you have in today's world, don't you have a magic pill you can give me that'll take care of all this?
No, there is absolutely no magic pill. It's the hard work of lifestyle changes.
How difficult is it for some patients to make these lifestyle changes, even though they know in some cases, life may be on the line?
It's extremely difficult. And I think the reason is because we eat for different reasons. We don't always eat because we're hungry. We sometimes eat when we're sad, when we're happy. We eat for social reasons. We eat because it's delicious, not always because it's hungry.
A real problem in this city,
absolutely,
right?
Absolutely.
Yeah. What percentage of patients do you have to continue to counsel? And who are the other members of your team at Ochsner? Are nutritionists involved, especially for patients who would need that assistance?
Sure. So you have to talk about lifestyle changes at every single office appointment, because it is hard and people fall off the wagon, so they need a contingency plan. So it's always important to talk to patients about the changes they're making and their support at home. As far as their support in our department, that includes diabetes educators, which will talk to patients about making those lifestyle changes. Nutritionists will also help with those patients. Seeing other specialists can also help them. So depending on how their diabetes is well controlled, sometimes we'll refer them out to different specialists.
We'll talk about that more in just a moment. So how is it managed medically? So there is no magic pill.
No magic pill.
But medicine may be a component.
Sure. So diabetes can be treated with pills, or you can use insulin. And some of the medications actually come in injections as well that you can now give once a week or once a day. So there's a lot of convenience to some of the different treatments. Some of the medications can actually help the way insulin's working in your body. Sometimes they help you make a little more insulin. And there are some newer medications, and I say new, but they've been out probably for about 10 years, that can help you lose weight.
Our guest is Dr. Susana Dipp, an endocrinologist, and we're talking about assisting people with diabetes and diabetes. Who are some of the people, you mentioned moving people to other areas of medicine. Who are some of these other people who can help with diabetes and treatment?
Sure. So when I see patients who come into my office and I'm worried about their kidney function, or when I do an exam and I look at their feet, I oftentimes refer them to specialists. So a podiatrist or a foot doctor, a nephrologist or a kidney doctor sometimes needs to be involved. Sometimes neurologists, because patients will have painful neuropathy, and they can be very helpful. Cardiologist, diabetes educator.
In extreme cases of diabetes, left untreated, there can be things such as amputation and those sorts of things. Are these stories you're sharing with patients who are having a problem with making some of these lifestyle changes?
I do.
That it's just not a matter of you're not going to feel well?
Absolutely. So I think one of the issues is trying to bring home that point that it may not feel bad right now, but in 10 years, 15 years, 20 years, it can affect your vision. You can lose limbs. You can be on dialysis. And of course, I have patients who have all of these things. So I try to relate these stories to my patients so that they know how imperative it is that they make these changes.
Talk about monitoring and how important that is with type 2 diabetes.
Sure. So one of the tests that I do in my patients is an hemoglobin A1C, or an A1C is how my patients like to talk about it. And the A1C is it's a simple blood test that's done every 3 months, and it can help me to know how the patients are doing with respect to their medications. And it can also give me some guidance as to whether they're in good control or not good control, and whether we need to add more medications.
Just the equivalent of the thing the auto insurance companies want me to put into my car so they know how fast I'm driving?
Pretty much. That's absolutely right.
Okay. And then as far as monitoring blood sugar levels in the people, so that's every 3 months where they come to see you.
Right.
I know people who are testing themselves multiple times a day. So what are they doing, and how often do they need to do it, and how is that helping them?
So diabetes, this is what makes diabetes a difficult disease. It's not just, hey, take a pill and you're fine. A lot of patients need to monitor their blood sugars at home, and it depends on how severe their diabetes is. So for people who are taking pills and are doing well and their A1C is under good control, they might check a couple times a week. For some people who are on a few more medications, maybe they're just taking bedtime insulin, they'll typically check their blood sugar 2 times a day, in the morning when they first wake up and at bedtime. And then for people who are on insulin at bedtime and before their meals, they typically will test at least 4 times a day before every meal and at bedtime.
Is there anything we can do to prevent getting type 2 diabetes?
That's another great question. So what patients can do who are at risk for it is lose a little bit of weight. So anywhere from about 5 to 7% has been shown in clinical studies to delay the onset, the full-blown onset of type 2 diabetes.
Can diabetes be beaten?
Sure, people have to make those lifestyle changes and lose a little bit of weight, but absolutely. And if you've been diagnosed early on, if you take really good care of yourself, you can delay the onset of diabetes.
So, but is it always there? When you say delay the onset, is it always there? Certainly, the risk.
The risk is always there.
That's
exactly.
Right.
The risk is always there. But yeah, of course, there are patients that I've seen who have started on insulin because their sugars are very high, but they make really good lifestyle changes. They lose weight, and we're able to titrate or decrease the dosing of insulin appropriately. And they can just be managed with what we call diet controlled. That's what we call it, diet controlled person with diabetes.
All right. We want to wrap up with some myths involving diabetes, and this is the Ochsner Game Show version of our program as we wrap up. So, Doctor, why don't you ask me, and I have seen some of these, but I'm going to answer based on what I would think,
Sure.
not what I would know, and feel free to play along at home. So, go right ahead, Doctor.
So the first statement is diabetics should not eat carbs. What do you think, Tom? True or false?
Only because not is all in all caps, I'm going to guess that I probably should stay away from carbs.
So the answer is false. So carbs are in a lot of different types of foods. So not just potatoes, pasta. So some vegetables, fruit contain carbs. So I don't think that it is an easy thing to abstain from all carbohydrates. Certainly you want to make sure that you're choosing healthier carbs, high fiber carbs. And if you are a lover of mashed potatoes, that you take a smaller portion of a carbohydrate.
Good advice. Question 2.
Fruit is healthy. What do you think?
If you had asked me 10 years ago, I'd have said definitely, and I have to have, how many portions a day of fruit, 3 or 4. I know now, not from just doing this program, that fruit is loaded with sugar, and maybe too much fruit is probably
absolutely.
a bad idea.
So it's a true and a false. So you would have gotten credit either way. So it's true. Fruit is healthy. It has vitamins that we need. It has a little bit of water, vitamins, some cellulose.
Some fiber.
Some fiber, absolutely. But too much can increase your blood sugar. And so you have to eat it in portions.
Are there some fruits you would recommend over others, or some to stay away from?
Yeah, absolutely. So the berries are great because they tend to be lower in sugar. So strawberries, blueberries, and they're also available frozen. So for people who like to make smoothies in the morning, they can put a little bit of the smoothie with some low-fat yogurt, and they can have a healthier fruit shake.
And an antioxidant component as well. Question 3.
So being on insulin means you have failed to take care of your diabetes.
I would think that's false.
Absolutely right. That is false. So, different doctors have may decide to start insulin on a patient. So my typical experience is people who have symptoms and are coming to me for the first time, people with very high blood sugar is the best treatment. What I tell my patients, the Cadillac of treatments is insulin, because I know it works. I know that people will start to feel good on it because their sugars are going to normalize, but it may not necessarily be the forever treatment.
Next question.
Once treatment is started, you can eat whatever you want.
I know better than that. That's got to be false.
Absolutely. So it's false. So again, lifestyle and eating properly is the foundation of your diabetes care for life.
And the last one?
I do not need treatment because I feel fine. What do you think?
Well, again, because not is in all caps, I'm going to guess that that's false.
Yes, it is false. So remember that initially people may not have symptoms, and that's the hard part of diabetes, is having to coach someone or help them make changes when they are not having a lot of symptoms.
So lots of us have symptoms that may or may not be diabetes, and we're encouraged to go see our doctor at least once a year for a checkup. Is this the kind of thing that a doctor is checking for on a regular basis?
So generally, patients who are over the age of 45, who have risk factors, who are overweight or obese, should be tested by their primary care provider.
And is that a test we would add if we're over 45? Is that the age you recommend as well?
Yes.
Is that a test we should be asking for, especially if we have that family history? And
Absolutely,
some of the other,
absolutely. You should ask for it, and providers will screen for diabetes, because it is not just my recommendation, but it's also the American Diabetes Association recommendation to screen patients who are at high risk over the age of 45.
And finally, we don't want to give people false hope, and we also want people to stick to the restrictions you've given them. But if I had you back here 5 years from now or 10 years from now, will there be that magic pill that we won't have to worry about this?
I don't know about a magic pill, but we definitely have incredible treatments that can help people take care of their diabetes a little bit easier than perhaps 5-10 years ago.
And what's the last thing you want our viewers to know?
Lifestyle changes is really the foundation of not only diabetes treatment, but also prevention.
And I'll ask you to tell the story you told me as we were getting started, or just before we got started, which is the birthday cake story. Because no one likes to be told never. So you can give them at least that hope as we end.
So what I tell my patients is, of course, on your birthday, please enjoy a piece of cake, but it cannot be your birthday every day.
Good advice. Dr. Susana Dipp, thank you so much for being with us.
Thank you.
All right, great information. Again, I want to thank the doctor for the information she has provided and for her work in the Ochsner Health System. To make an appointment with any Ochsner physician, including this week's guest, or to register for any of Ochsner's Hello Health seminars, you can call Ochsner at the number you see on your screen, or send us an email. Here's our address, hellohealth@ochsner.org. As a reminder, you can re-watch this week's presentation and many of our other Hello Health programs on Ochsner's website at ochsner.org. Just type Hello Health in the search box. All right, thanks again to this week's guest. Thanks to Humana and Ochsner for making our program possible. And our final thanks, as always, is to you for your support of this program, Hello Health. I'm Tom Bagwill, and we'll see you next time.